Hi everyone, it's Athena here from Courage Coaching. I hope you're all well and have had a good Easter. Today's video is going to focus on the different treatments for PTSD sufferers, and I'm going to talk about what a successful treatment looks like for somebody who has PTSD. Therapy for PTSD usually focuses initially on helping the sufferer feel comfortable and feel like they're able to cope better with their symptoms. It is supposed to help them feel safe, so the therapist that treats the patient will restore a feeling of calmness to the nervous system and educate the person about what it is they're experiencing and why. Avoidance is something very common with people who have PTSD because of the constant triggers that they have to very minor things in their environment. And avoidance means that they will avoid places that trigger them, they will avoid sounds, they will avoid smells, they might hide away in their home, they might avoid certain people. So when they first start treatment for PTSD, the therapist will help them slowly stop this avoidance cycle, especially in areas where it isn't necessary. It is important that this cycle is interrupted because it will affect their life and it will affect any relationships that they may have with a partner. Now, the different types of therapy for PTSD are cognitive therapy, exposure therapy, EMDR therapy. Sometimes art therapy is useful. Now, the first one I want to talk about is cognitive therapy. In cognitive therapy, the therapist will help the individual understand and change how they think about a trauma and the aftermath of that trauma. Another type of therapy used is exposure therapy. In exposure therapy, the goal is to have less fear about the different memories that come up. For PTSD sufferers, memories and flashbacks are usually happening all the time, and every time that happens, the person is reliving the experience. So an exposure therapist finds a way to help the sufferer not fear the thoughts and feelings that they may be having. In the therapy session, the therapist will ask the sufferer to talk about the trauma repeatedly and to find a way to control their thoughts and feelings about the trauma. They also have to learn not to be afraid of their memories, which of course is easier said than done. They may feel that it's quite strange to think about stressful things on purpose, because the therapist will require that they do that they constantly think of the stressful things and memories that they have. But over time, the more that they talk about these experiences, the less overwhelmed they are supposed to feel, and the less afraid they're supposed to feel of the memories or the flashbacks that they have. Something that a therapist does is they'll ask the person to focus on memories at the beginning maybe that are less upsetting, before talking about memories or flashbacks that are more upsetting. And this is called desensitization, and it allows the person to deal with the bad memories a little bit at a time, with the less severe to start off with and then the more severe as time goes on. And the therapist may also ask the individual to maybe think of a lot of bad memories at once. This is known as flooding, and it helps the person not feel overwhelmed. So for instance, when they have a flashback and then they have another flashback and they have a lot of memories coming up all at once, it is normal for them to feel overwhelmed. But in a therapy session, the therapist teaches the sufferer to not feel overwhelmed, because they basically practice what it would be like to come up with a lot of memories all at once. Another very successful treatment for PTSD is EMDR, which is eye movement desensitization and reprocessing, and it is very helpful because it basically desensitizes the way that they feel about certain flashbacks or memories that they have, and with certain eye movements that happen, or with certain tapping from left to right, which is bilateral stimulation, what happens is the flashback and the memory, which feels very real in the present, is somehow reprocessed, and it is put in a part of the brain where it has become a memory as something that's happened in the past, and it isn't as overwhelming anymore. It doesn't feel as scary anymore. So EMDR is very successful for trauma, and although a bit controversial because people somehow don't really understand how it works, Some people are just too scared to try it, but it has proven to be very, very successful for people with PTSD because it greatly reduces their symptoms, it reduces nightmares, it reduces flashbacks, and it kind of creates a distance between the feeling that the sufferer has and the emotion and the memories that come up. Now, according to Psych Central, successful treatment of PTSD allows the traumatic feelings and memories to become conscious and integrated or digested so that symptoms are no longer needed and eventually go away. This process of integration allows the trauma to become a part of a normal memory rather than something that is perpetually feared or avoided, which interferes with normal life. Recovery involves that the sufferer feels empowered, they re-establish a connection to themselves, to their feelings and to other people, and they start to slowly find meaning in life again without constantly being overwhelmed. Recovery also allows patients to heal so that they can resume living, and it allows them to feel better in their intimate relationships. I hope you found the video useful today. It is something that I wanted to talk about for people that may have a friend or a partner that suffers from PTSD. It's worth recommending these treatments if they haven't already been able to see a therapist. Of course, just as with any therapy that somebody has, it might be that somebody starts seeing a psychotherapist that isn't appropriate, that isn't a good fit, and for that reason it is important to encourage the person with PTSD to maybe try a different therapist who has a lot of experience with treating PTSD, somebody who knows all the different types of therapies that help people with PTSD. And also sometimes things like group therapy can help, online forums, as well as art therapy and exercise. If you like my videos, please subscribe to my channel, and also I have signed up to Patreon, which is a really good platform for supporting people who make videos or who create content that other people find useful. I would appreciate it if you could check it out, and if you would like to support what I do, or if you find what I do helpful, then please sign up to my Patreon page, become a patron, and you might get a few goodies as well. So thanks very much, have a good week, and I will see you soon. Take care, bye.